Is it okay if I address this to Bill Hennessy?
Sure.
Okay. You were talking about how in the United States we don't like to limit our opportunities and our options. But the problem was, and this has been known for decades, that there were fewer and fewer people who had health care insurance. And I do want to distinguish between health care delivery system and health care insurance, because really what Obamacare was about was health care insurance more than the delivery system, which also needs to be addressed. But anyway, the problem was, I mean, you could look anywhere over the internet, any kind of insurance, and you could see that people were dying because they did not have insurance. Sometimes they didn't have it in the beginning, they couldn't afford it, and that would be something that would come under healthcare savings accounts, because not everyone could afford those. And secondly, there were people who had healthcare insurance, and the insurance companies were dropping them. And sometimes it was totally bogus. They were making up pre-existing conditions like acne and things like that. So what I see is that we needed healthcare insurance that everyone could get, and I personally believe that this is an American value and that everybody should be able to be covered.
Well, thank you very much. I'm glad you took the time to script out such a well thought out question. On the first issue of insurance delivery or insurance versus delivery, whether or not the government's involved, there's virtually no way to economically separate the price that one is willing to pay from the quality of service one's likely to receive. If I were to offer $500 for an automobile, it would not be the same car I'd get as if I offered $25,000. With the government will, as anyone who is a victim of government insurance now knows, the government will drive down the cost to the lowest possible number. It has no incentive to support quality. It has none. It can't compel, we hope, with the way this legislation goes, you wonder if maybe they'll take that upon themselves. They can't compel someone to be a physician or a nurse or a technician. So the people who are willing to go through the difficulty of the education, the risk of taking someone else's life into their own hands, which is an enormous emotional risk for a human being, the quality of care that you're going to get is going to go down. As fewer people are willing to become physicians or clinicians of any kind, the availability of medical care is going to go down. As the government drives down the cost, the places in which you can receive health care are going to go down. Trying to separate insurance or the money from that which you receive for the money is foolish. It's impossible. You can't do it. Secondly, on the issue of people dying for lack of insurance, as Phyllis Lafley just pointed out, in England, in the countries where on which Obamacare was modeled, there are people dying because of the insurance that the government offers. And finally, I'd point out that whether or not it's a good idea, it's against the law. And if people can't understand that when a government that can break the law can break your legs, you're in trouble. Thank you.
If I could say real quickly, Bob, and Phyllis has a comment. One canard that has been sold to the American public was that somehow the insurance companies are the worst actors in this. What happened with Obamacare is we didn't take on the insurance companies. In fact, the insurance companies did not want to have people buy health care insurance across state lines. They did not want to allow competition where we could have people buy different levels and break the monopoly of the mandates. So, you know, although there are some things in the Obamacare bill that addressed, say, pre-existing conditions, they addressed it from the standpoint of bureaucrats making decisions, not families and healthcare systems deciding what's good for them. So be careful what you hope for when a bureaucrat gets to decide what your pre-existing condition is or what your choices are. I recall that Bill Moyers had someone on, and he said, I used to be an insurance executive, now I realize that government bureaucrats, we have to rely on them, not insurance executives. Well, I think we have to make sure we keep our insurance executives in the market, competing and the values we want. But I think that government bureaucrats have shown generally that they don't lead to a place where it's as good for America and Americans as we want. So, Phyllis, you had something to add?
Yes, the Obama administration got the insurance company to support Obamacare by promising that they would mandate that everybody buy insurance. Right. So that's the way they were going to pay for it. Now, I think what we really need to decide is, do we want to live in a free country or do we want to live in a socialist country? Now, all of these socialist countries are all over Europe and Canada. Why do they want to come here when they have a health problem? They are spending too much. They are not providing the best kind of care. And the people who can afford it come here to get their treatment. Socialism is a system of spreading the poverty and then giving goodies to your friends, as Ed pointed out, well, with the waivers to Obama's friends. It is a system of government control. And if you look at all the constitutions of these socialist countries, they are a list of what the government is going to do for you. That's what socialism is. They pretend to do for you. You look at our Constitution, it's a list of what the government cannot do to you.
That's right. That's right.
So I invite you, for further information, you could go to eaglefarm.org and you can pick up some of my Phyllis Schlafly reports.